Hi there, happy Sunday. I am Dr. LaQuita J, and welcome to my YouTube channel where I talk about all things in between being and becoming a pharmacist. How you doing? You all right? If you do not know, I am Welcome to Success Sundays, and if you do not know, I am a Naplex Success Coach. I help pharmacists pass the Naplex in 6 months or less by shifting their mindset, strategize their plan, and study effectively for the Naplex exam. And if you watched last Sunday's video where I talked about the outline between 2021 and 2025, as you do know, or you may not know, that the NABP, the National Association for Board of Pharmacy, they have issued NAPLEX competency statements, or now the NAPLEX outline, and which is a document to give you idea for ancillary pharmacists of what you can expect on the NAPLEX exam. And about every 4 years or so, they will update this. And they have released these statements that will be taking effect on May 1st, 2025. But I told you this week I want to talk about, if I was taking the exam, what would I do? But honestly, I would say this: I need to break this down to two different videos as well, because because again, I am a Naplex Success Coach, and I have the Naplex Play Challenge. That's in January. Like we're running now. It started. If you watch the video, it's already started, right? For January. And these pharmacists are taking the exam by April 30th. Well, I'll say before the new standards hit. So I was thinking, what would I tell you if I was you my client? What would I tell you, right? So that's what I want to do today. I want in this video, not today, because you may be watching it at night. I don't know, but in this video, I want to talk about, how would I study exam according to the 2021 NAPEX competency statements, right? So let's get into it. And let's get into it and simply saying, if you haven't watched last week, we go now comparing the two, you can go watch the comparison. But this week, we're talking about if I was to take the exam, how would I approach and what would I do? So one of the things I would do if I was studying the exam using the 2021 NAPLEX competency statements, I simply put, if I was to take the exam by April 30th, 2025, my approach will focus on the task-based structure of the exam while emphasizing that specific knowledge and skills detailed within each competency area. So here's our approach. One thing is to do, let me get my thing here. One thing is to truly understand these competency statements. Familiarize yourself with all the 6 areas of the 2021 competency statements. Look at me. I'll say domain. Area 1, obtain, interpret, assess data. 2 is to identify the drug characteristics. 3 is develop our management treatments. 4 is performance and calculations. 5 is the compound, dispense, or administer drug, our management delivery service, and 6 is development of management practice. So the key thing is you want to make sure that you familiarize yourself with these 6 areas. But pay a close attention to the weight that each area is prioritizing. You see that area 3 has 35%. Area 1 has 18%. Area 2 and area 4 both have 14%. Area 5 has 11, and area 6 has 7%. So I will familiarize myself with that percentage. Second thing I would do if I was studying for the exam is I would create a study plan based on those areas. And what I do with Pharm to RPH and with the NAPLEX, I always done this in my coaching practice for like the last 4 years with these company statements is I tell my clients to allocate time based on their percentage of the test content, right? Because if you look at this, and let's do simple math. Let me get my calculator ready, right? If you look at area 4 is 35% of the exam. Area 2 is, and this is about treatment plans. Area 2 is about drug characteristics, is 14% of the exam. Then you have assess, obtain, and patient information, that's 18% of the exam. 67%, that's 67%. 67% of this exam is focused on, is dedicated to like the treatment, the planning, the therapeutic monitoring, and the clinical endpoints of a patient. This is the time where you spend a lot of your bulk of your time. And then it's like interpretation of drug characteristics. These are the disease state chapters, as I always say. So 67% of your studying, bulk of your studying spent on disease states. Because if you go break down, look into it, this are more so the disease states chapters. So put your time there. Area 4 is standalone, is 14% of your exam. It is calculations. But in calculations, it's compromised of all calculations. So be mindful of that. That includes theoretical pharmaceutical calculations like the flow rates and I would say flow rates. I think LaQuita said something. It's not that. Um, just for calculations. I can't think of mine's going blank, but flow rates. Because I was thinking, and then you got to think about it's like other unique calculations like the ANC. Calculate the ANC. Calculate the calcium corrected level, phenytoin corrected level. Those are specific type of calculations, and it also encompasses pharmacokinetics calculations as well. And it also, of course, is biostatistics. So there's different type of levels of math for that, but it's all encompassing. And even that, so if you go even to further, it specifically says in down here in 4.8, it has epidemiological and pharmacoeconomic measures. So that's also different. All things is book of it's all those things that comes into for calculations. Then it got compounding. Again, compounds is a standalone thing, right? You want to spend time understanding compounding, and then area 6 is the safety and quality systems as well. So you want to make sure that you create a study plan that says, okay, disease states for sure, calculations, practicing. So of course, I always say practice calculations every day. Don't just do like do basis and regular calculations, right? And then you go into disease states as well. Pick about how many disease states you want to do from that perspective. I'm about to tell y'all a secret, but I won't. But that's how you break it down. And then the third thing, so the first thing you want to do, familiarize yourself, understand competency statements. The second thing you want to do is make sure you create a study plan based on those areas. 3 is 2, you want to make sure you leverage quality resources. Use, whatever you feel that's needed. If that's your any type of prep guides that you have, me as your Naplex coach, you want to utilize those like just good quality resources. And let me know in the comments if you want a video, like, because I get this question often asked all the time is, what's the difference of whom should which company should I buy? And this thing of I'm not gonna I said if you want a video about that, let me know in the comments you want a video about that. But anywho, that's the thing. And a fourth thing you do is like approach each competency area with strategy, right? So area 1, being that area 1 is focused on obtain, interpret, assess, you want to make sure that you look at those key laboratory and diagnostic findings. You want to make sure that you go into like you're familiar with like patient history. In the beginning of each disease chapter, it tells you like the signs and symptoms of the disease. Like if the patient presents with not levothyrosis, the patient presents with hypothyroidism. Do you know the patient's the signs and symptoms of hypothyroidism versus hyperthyroidism? What does that look for? What are some risk factors, like such as a risk factor somebody who was to increase risk for having osteoporosis? Those kind of things you want to think about. That little fluff information that you did omit and you want to miss out on, that's the things you want to focus on. So a quick study strategy may be for you is to focus on like that simple information, like can I know information about this disease state just based off these patient in like the things they're giving in the case, like the signs and symptoms, the patient history kind of things. It's like quote unquote like the patient history. You're gonna look for those risk factors because you're looking for what kind of things the patient is doing to increase the risk factor of whether increase the risk of getting that disease. You want to look into that. So that's like one of the things of you want to make sure you approach when you're thinking about area 1. Area 2, you want to look into the drug pharmacology, the safety warnings and things. Those things when it comes to the pharmacology, simply saying like mechanism of action. Before you learn the drug, what is the mechanism of action of this drug? What that's like a key thing they say about pharmacology, like certain side effects. Not saying you gotta know all side effects and certain things, but what are some key things you should know? Like, like lisinopril, that's cough, right? You think hyperkalemia, cough. Something as simple as that. You want to think about the also like the therapeutic class. Like again, what drug, what disease state is this drug particularly? What drug, what does it say is this drug used in? That's definitely one. Do you want to think about those key things when it says that this drug is not used in pregnancy? This drug is not used when breastfeeding. Those are drugs you want to come in and put there because you need to know like those REMS programs drugs. That's very, very important as well. So that's how you want to do those specific drug characteristics. The things of like key things you want to know. I always say mechanism of action if anything is not. Know that. And then it's like some side effects. You won't remember all side effects, but just some key things about this drug that's particularly unique. I.e., like I said, most people know that lisinopril and ACE inhibitors cause a cough. The thing is, why the cough? Go back to the mechanism of action. The mechanism of action tells you why lisinopril and ACE inhibitors cause a cough. If you don't know, go back and study. I'm not telling you that. It's too easy. When it comes to area 3, in terms of the development and treatment part of it, that's when you want to make sure like you focus on those therapeutic goals, that monitoring, that drug dosing, those things. You want to make like the contraindications, the interactions, again, some of the side effects. Those are some things. So a good study strategy for that would be to like focus on, the treatment plans, like what do the patient need. Think about real life scenarios that can happen to triage these patients and recommend therapies. You want to think about that. Think about some things that you want to monitor, like when a thing is like, for instance, prime example, and this is a hint, this is a freebie for you. For instance, in time, most of the time drugs that help the liver in a sense, they also hurt the liver. Or like most of the time, like when drugs, like for instance, you learn any drug that's like treating hyperkalemia or hyper, like all the imbalance of electrolytes, it causes the opposite. So if it was like hyperkalemia, you use a drug for hyperkalemia, then it also has a side effect causing hypokalemia. Something simply is put as that. Or like a drug that's like, for instance, if you look at anticoagulations, right? All those drugs, anticoagulations, all those drugs are doing is like preventing clots, are treating clots, right? And that's why the side effect of it is increased bleeding. The side effect is increased risk of bleeding because the whole point of the clot is you trying to dissolve it and thin the blood. And by me thinning the blood so the clots won't form, or prevent the formulation of it just increases the bleeding because the blood is too thin. Hence, those kind of side effects, things and stuff you want to think about. When it comes to calculations, again, and again, practice, practice, practice calculations. So that's where you want to do dedicate a daily time to really solving calculation problems. Master those common ones like osmolarity, the dose conversions, IV flow rates. You want to make sure that you do that. That is definitely the study strategy for calculations. When it comes to compounding, again, that's about the compatibility, the stability, and techniques for those sterile and non-sterile compounding, as well as those delivery systems, right? Make sure you review those USP standards for sterile and non-sterile compounding, hazardous drugs. Make sure that you familiarize yourself with the steps of administering certain dosage forms, and familiarize yourself with how to appropriately store the storage and the handling and the disposal of some medications. Those are the kind of things you want to look for when you're studying Area 5. And when we go into Area 6, I'm not talking too fast. Let me slow down. I get so excited. Let me just slow down. Okay. But when it comes to Area 6, it's that development of the development our management practice of it. Like you want to make sure like those interdisciplinary collaborations and transitions of care. So a study strategy may be is to learn like the different roles of pharmacists in continuity of care. Like what does that look like? What does pharmacists look like in a role of disease prevention programs, like immunization and stuff like that? Learn about informatics systems that use support for support safe medication use. Those are some things. Think about those vulnerable populations and those special populations, i.e., pregnant women. Those are some things that you want to consider when you're studying for the exam. Another tip is also for ourselves, and this is just general thing of this. It's like make sure you have test taking strategies. I know a lot of times, like make sure you review your weak areas. Majority of times, I stress this a lot with my clients. I even have a whole reviewing system in our program, the Naplex Play program. We have a whole reviewing system that I have formulated, in which it helps, constantly helps pharmacists and my clients to really focus on identifying, reviewing your weak areas to help you to really just analyze the performance of your competency areas and constantly revisit those weaker topics that you're not sure of, that you're not certain of. That is the absolute first thing I would also say, like, to do. I know a lot of times, especially in my line of work, I do work with clients who have taken the exam, NAPLEX exam, more than once, right? And in my line of work, I always tell them, a lot of times people want to say, "Hey, take more quizzes," or "I need more questions." No, you don't, because at the end of the day, when you took the exam and you left out the exam room, you did not say one time that I needed more questions. Your words was, "I wish I would have studied more. I wish I would have reviewed more. I wish to cover something more." So let's spend our time on reviewing. So you don't take anything else from me, anything else from this video, or whatever. Make sure that you review your constant weak areas. Okay, that is absolutely important. And the other thing is too, make sure that you have a balanced approach with breaks. And like I've said before, if you ever watched my Naplex study with me videos here on YouTube, you see that it's a study where we do 15 minutes, like it's always a 2 hour period, because it's a thing of you got to take breaks. You got to take your mind off things. You got to have a consistent study time. It has to be like, functional. The only time I would tell you to like stay in one sit and don't move is if you are in a scratch mode, you're acting like you're studying for the exam. The exam's a 6 hour test. Sit for 6 hours. That's really it. If you're not sitting for 6 hours straight or like you act like the exam, take you a break, okay? I know I threw a lot at you. I know I did. I was really, really excited about this, but I do want to make sure that you align if you are preparing to take the exam by April 30th, 2025, I want to make sure that you align your study approach with the 2021 competency statements, especially for that change. And again, one of the key things you want to do, make sure that you understand the competency statements. You want to make sure you create a plan that, a plan based on the areas if possible. And you want to make sure that you leverage like high quality resources, whether you need a Naplex coach or you just need another prep book. Man, then make sure I gave you a big bulk of tip of how to approach each competency area strategically as well. And then again, the test taking scratch, I definitely want to reassure again. I say review, and definitely review. And also just don't forget to take breaks. Like I know it's a lot of stress, but don't forget to take breaks as well. You need a well balanced approach and exercise, have adequate sleep. That's also very, very important. Okay. But that is all I have for you today. It is my hope and ensure that this would have, ensure that you have a really good focused preparation for the NAPLEX. You have the specific skills that you need and the tasks required for the exam, and making sure that you have the most structured, task oriented framework to really build your confidence and competence for this exam. Until next time, remember that pharmacy is only if you are. Now go be great, and I will talk to you guys later. Take care.